So our special interest section closely aligns with the American Headache Society's mission to improve treatment options for all patients with headache disorders. We really focus on patient care, education, research, and advocacy. And we break down our section's mission also based on procedure types. So first of all, there are procedures performed by headache specialists and neurologists, which include botulinum toxin injections, nerve blocks, and trigger point injections. Then there are procedures that are performed by other specialists, such as surgeons, which include nerve decompression surgery, stimulation implantation, deep brain stimulation, and even bariatric surgery. And then finally, there are procedures that are performed by patients, such as self-stimulation, and there are multiple devices on the market currently for that, as well as self-injectable therapies. So one of our most successful endeavors during my term has been the cadaver course. So this is a course that was conducted at the 2019 scientific meeting and the 2019 Scottsdale Headache Symposium. And it was done in conjunction with the temporomandibular, cervical spine, orofacial pain section, which is headed by my friend and colleague, Dr. Marcelo Romero Reyes. It was very popular, both the courses, in that they were sold out very shortly after they were posted online. And there were actually waiting lists for both of them. And they did so well that AHS has decided to make this a permanent fixture at the American Headache Society meeting in Scottsdale. Basically, it's a cadaver course which demonstrates the anatomy of the head and neck, both in terms of the pathophysiology, what structures go awry and cause some of the pain disorders that people experience, as well as the reasons that we perform certain procedures, the techniques applied, the volumes used, and things like that. And I find this is really important for clinicians to really get a good handle of the anatomy. One of my personal areas of interest is the performing of nerve blocks and really why they're performed, how they're performed. There's a lot of variability, and certainly it's a very heterogeneous term in that, you know, the technique and volume that one clinician uses can be very different from another clinician, and that variability can have significant ramifications both in terms of the efficacy of the procedure, as well as, unfortunately, at times in the chart it being noted that the procedure was ineffective, while, you know, if it was performed with a different technique or a different volume, it may have been effective. One of the other successes we had was a pre-course which was held at the Scottsdale Headache Symposium in 2019. It was titled Neuromodulation for the Treatment of Headache Disorders, Applications, Approvals, and Access. This course was held in conjunction with the trigeminal autonomic cephalgia section. And basically this course really delved into nerve stimulation, both for the prevention and abortive therapy of both migraine and cluster headache. Because of access, unfortunately, these are therapies that many patients are unable to use. So it's really important that providers are aware of how best to select patients who may be good candidates for these types of therapies, as well as some of the barriers that exist in terms of FDA approval, as well as access once these devices are FDA approved. This section really, one of the great things is it is very large. And as time goes on, more and more headache specialists and even non-headache specialists are performing procedures. So for there to be a group like this is fantastic for collegiality, but also for collaboration. You know, the section itself is working on projects as a whole, but also when colleagues are able to network with each other at meetings, but, you know, in this case, due to COVID-19 over virtual meetings, it does foster collaboration and to work on research projects and to further develop protocols and indications for when we use certain therapies.